My name is Brenda Msangi and I'm the director of the Disability Hospital, CCBRT. So the Disability Hospital has been running now for over 15 years. We receive quite a number of patients, eye patients, between 350 to 400 patients a day. And the OPD was getting quite overwhelmed with the number of patients. So definitely as a hospital, it was a priority to see what can be done. One of the challenges that we had with the eye services was that there was no connection between the front office and the clinical services. What I mean is the cashiers, the registration team, so the patient will move from one unit to the other and those units were not connected. So what we're trying to do with this project was to see how we can connect these services from the time the patient arrives at the reception to the time they get to the clinical room and the time they go home. So by doing this, we will improve the patient flow, and the outcome also is to improve the quality of the service that we're providing to this eye patient.
Hamad Raif, I'm Lean Management Specialist at CCBRT. I started with the management team when we had the discussion when I first came in about which area we need to focus on first, and it was agreed with the management team that the IOPD, because it was the most obvious pain in the organization given the volumes of patients and the problems that it had, that this is where we wanted to start our model set. The first thing we did is that we had to analyze the current state, and we did that by following patients through the OPD in the current system, and we drew a current state map. And from that analysis, we started moving forward into imagining how we want it to look like in the future, and then we came up with the plan around the future state, which was basically that the layout of the OPD in the current state as it was because when the hospital started, it was not designed to accommodate the number of patients that we were seeing. And it was obvious that if we need to make an improvement, we need to make some changes around the layout, in addition to some improvement in terms of how we treat the patients from reception all the way to the consultation rooms. So, for instance, the biggest thing is that we had several waiting areas spread across the OPD. The first thing was that we will move all the waiting into one central area, and from that point on, our objective is to have a journey for the patient from the point of registration all the way to the consultation room within 30 minutes. So the VA stations, we had 2 VA stations previously that were spread on a 6-meter charts, and then they were right in the middle of the corridor. There was no privacy. It was a difficult setup for the nurses and for the patients. We kind of improved that by introducing a 3rd VA station in a separate area where it's all partitioned, and then concluding with 3 triage stations that are also partitioned properly in a way that gives more privacy to the patients and to the nurses that are giving the triage assessment. And then all the way to the consultation room, where we moved all the waiting areas that were there, and we only have 1 buffer bench in front of every consultation room, and that keeps the flow steady to the consultation to the doctors.
Part of the implementation plan was to come up with a team, and the team was staff from different departments who one way or another play a role in the experience or the journey of the eye patient. So we had people from HR, from registration, from cashiers, we had clinical presentation nurses. So it was a very good team that could look at different opportunities, should I say, rather than challenges, on how to really work on this project together. We had to inform the ministry, we had to inform the public as well, that we will be closed for 1 week. And why did we close for 1 week? We really wanted that time to really have time with the staff to do a lot of training for them to also understand what we are embarking on. It was 5 days, but it was quite intense. The staff were not on holiday, but we used that time to really have intense training to the team and also to build a team. So we had lots of team building exercises, fun exercises, but at the end of the day, with an objective at the end, what do we want to achieve once we opened the gates the week that followed. So that was actually quite great to have that week.
Jina langu naitwa Dr. Jerry Jecha, ni kiongozi msaidizi kwa idara ya macho. Kwa huduma ya macho katika CCBRT, mwanzo sisi kidogo ilikuwa ni tatizo kwa sababu ya wingi wa watu na ule mpangilio wa mtiriko wa wagonjwa ulikuwa hauko sahihi. Ni kama watu wanavyogombania huduma fulani katika jamii ambazo hazina mpangilio, kila mtu anataka apate wa kwanza. Kwa hiyo kulikuwa na wagonjwa wengi sana kiasi kwamba tulipata changamoto mno. Inafika mahali huoni mtu anatabasamu kuanzia asubuhi mpaka jioni. Sababu kubwa ilikuwa ni kuchoka na wingi wa wagonjwa. Hata maelekezo ya mgonjwa, ilikuwa ukimpa mgonjwa maelekezo hawezi kukusikiliza ama kukuelewa, na pia kama kuna dharura inatokea ilikuwa ni vigumu sana kuweza kugundua mara moja. Kiukweli sasa hivi kila mtu anatabasamu na wana nguvu, wakiingia asubuhi mpaka jioni watu wako wana nguvu ukilinganisha na zamani. Sasa hivi kidogo tunakwenda vizuri, ule mtiririko wa wagonjwa unakwenda vizuri na kuchoka pia hakuna, na kila mtu anaridhika, japo bado kuna changamoto lakini kuna mabadiliko makubwa sana sana sana.
Well, the biggest challenge was resistance to change. We have been operating in that exact same way for 15 plus years. So to change that, it's not easy. And some people get on board and they get excited, and some other people it takes them time. But the reason why it worked out so far is that we have this team that kept pushing and kept moving forward, and we had the support from management in terms of we really need this change to happen, and that's how we made it through, especially after the training week that we had.
So to me, this is not the end. You know, we've started this, we've created this eye model cell. It doesn't end there. It's now we've done it. How can we review it? How can we make adjustments? Because to me, this is about continuous improvement. It's not that there's a full stop. It's literally we've just began. And as day by day goes as well, we're doing this, we're calling them daily recaps at the end of the day, just to see from the team, we come together and we say, okay, how was our day? What can we change to make better tomorrow better? So that we can continuously improve. And the only way we can continue, this will not end at the IOPD. This will be for the whole hospital. So then we will see what is our next priority, and then we can create now the same model to the other units as well.
CCBRT has been trying with its own hospital to improve its management, the quality of its services, the timeliness, the customer satisfaction elements. And the way they've done that is by taking a lean management system, which is a whole process improvement system that's from the West, but adapting it to the local context so that you can improve the quality of service provision to customers in the hospital setting while lowering their costs.